Welcome everyone to Let's Talk. I'm your host, Ingrid Lockley, and our special guest today is Garvey Dobbins. He's a psychiatric nurse practitioner with Talk, Work, Heal, and Health and Wellness, located here in Richmond, Virginia. And he's here to talk about mental health. Good morning, Garvey. How are you?
Fine, I'm doing well. Thank you for having me on, Ingrid. I really appreciate it.
Oh, you're most welcome. Thanks for joining. Let's talk. We appreciate that as well. And what a great way to start. This is the first show for us, and what a great way because this is May is considered the Mental Health Awareness Month. Is that
That's
correct?
right.
Let's know what exactly is mental health.
It, in the way that we look at mental health in the United States is basically a set of behavioral um, features, uh, a set of behavioral features that we may see in a person if they're having a specific mental health diagnosis or condition. And so what we really look for is how is a person reacting to their environment and how are they behaving within their environment that would dictate if they are having some type of mental health disturbance or not. And a lot of times, um, if those things can't be seen in behavior, then it would be given to a practitioner, for example, through reporting. So in other words, through patient report. So I may not see that a person has depression, um, but I may have a client that's telling me that they are experiencing depression, and we may explore what that depression looks like. And so we're going to look for a combination of behavioral characteristics as well as what the patient will report or the client will report. And the other thing we will look at is what is their ability to function um, currently based on potentially what their highest level of functioning is. And
Mm-hmm.
so let's take depression, for example. A person may say, well, I'm experiencing some significant depression. So what we may ask them is, what what do you typically do during the day, or what are you able to typically do during the day? Um, and then and then we would match that or try to link that to how are they functioning now, and that would tell us a little bit about the severity of their depression, for example, and then what treatments to potentially recommend.
Why is it so important to have your mental health evaluated or to look into that as we do our regular physical annuals and our dental appointment? We always get that done. But why
Right.
is that so important to have that evaluated?
I think that um, mental health, and of course I'm an advocate, but mental health is, in I think, is arguably more important than physical health. Um, you can have you can be in peak physical condition, but if mentally you are hurting, then you still won't be able to perform optimally. And
Mm,
they are linked together. Physical health and mental health are linked together. But the point I'm trying to make is, in order to be the best version of yourself, both have to be in the best alignment. And so you can't have one without the other. But we
right,
also
yeah.
know that the brain is very powerful. And so the things that we tell ourselves and the things that we believe about ourselves are critically important to how we are able to function on a day-to-day basis. And so again, I could be strong physically, but if mentally I perceive myself as weak or inadequate or unworthy, then I may not be able to perform optimally. And so the idea behind what I consider to be good mental health is being able to pair with a mental health practitioner that can extract um, your, I guess, maybe your fears or potentially anxieties, or
Mhm.
if you're having some of those um, thoughts that may be discouraging, and we all have them, and
Yeah.
being able to create new ways of thinking about how you perceive the world and how you perceive yourself so you can become a better version of yourself. So I think that's really the critical key around why mental health can be so beneficial.
Mhm.
And a lot of times I think people wait until there's a crisis
Yeah.
in order to seek mental health. But I would really encourage people to, check in with a practitioner just like you check in with your PCP. You go for
Yeah.
a routine checkup once a year. You know what I mean? Why not go and see a mental health professional once a year as well, at a minimum, to kind of say, hey, listen, these are the things that have been concerning me the most. And maybe you can gain some new perspective on how to manage those particular issues that you may be going through at the moment, and that can maybe help you create a better balance for yourself as you continue forward.
Yeah. So what you're saying is most like a whole listen, you as a whole, the whole thing of you, your mind, your physical, and then some will also include the spiritual aspects of it. But
Sure,
I want to
absolutely,
ask you
absolutely.
a question too. A lot of times when someone goes to the ER, a lot of times they evaluate for the mental health status as well. But I
Hmm.
wonder in some cases how come doctors or physicians don't even mention about mental health. They just
Hmm.
basically going for their physical or recommend having something else. But very rare they mention about having your mental health evaluated. So
Hmm.
very good point. That's it's important for people to know that um, as being a person, as a being, everything includes you as a whole and
Hmm.
body as a whole. That's great. I want to ask you something too. What factors contribute to mental health disorders or issues? Can you elaborate a little bit on that, a little bit, Garvey?
Well, from a theoretical standpoint, the idea is that basically stress is the impetus of all mental health
Mm,
disturbance. And so if we use that model, if we accept that model is, and this is theoretical, but if we accept that as the impetus of all mental health disturbance, then the goal becomes, how do we either learn to manage stressors better, learn to mitigate stressors, learn to avoid stressors, and those types of things. And so, um, but it does make sense if you think about it. And the other thing that's interesting about stressors is that stressors are individualized. So something that may seem extremely stressful for one person may not have any stress for another person. Um,
interesting.
an example I give is, if a 5 year old, if the goldfish dies, if the 5 year old goldfish dies, that could be a very stressful event for that child, for that 5 year old child.
Yeah.
But for the parent, because they have more experience and they have more resilience because they've lived life longer, um, the parent understands that this is a part of life. We can just go to the pet store and buy a new
Mhm.
goldfish.
Yeah. Yeah.
And so, but stresses are individualized. And so how people learn to manage and cope with stress is going to be a large determining factor of how well their mental health will be. Um, so we also need to think about our communities that um, have, we have to think about our communities that create the environment where stressors are prevalent, or pervasive. And so
Hmm.
if we live environments where stressors are prevalent and pervasive, it increases the likelihood, or the percentage, that we may indeed have some mental health challenges because of the stressors that we are exposed to.
Now, you speaking of the environment, can you give just a little bit of examples of what that will look like for someone that's stressed in an environment or
Mm-hmm.
encounters stress? Just a little bit of
Mm-hmm.
that.
So um, let's say, for example, just the environment that we live in is physically harsh. Let's just say that the elements, there's scarce resources. Um, it's either extremely hot or extremely cold. You know, throughout throughout the year.
Hmm.
Um, Resources may be scarce in regards to either food, water, or shelter. So that creates a stressful environment. And so, the adaptability of folks in environments like that may be difficult for some people, and it increases the likelihood that some folks may have some mental health complications because of the stressfulness in that environment. Let's consider other options, though. Um, think about environments where potentially there's high crime, or um, high levels of violence, or like prison would be an example of that. There. So in a prison environment, for example, where there may be a high propensity for violence, and the cultural norms are different because it's more of a survival mode,
Yeah.
type of environment, then you may see folks who have, more significant mental health conditions because they're in a more stressful environment. And so a lot of times, if you look at our urban environments, um, you what you may see is environments that produce more stressful situations because of the nature of those environments. And so that's why a lot of times when we're trying to develop resources into helping folks who need mental health supports the most, we
Mhm.
may look at those areas that have the higher levels of either, violent crime or lack of resources, because there's going to be that correlation between um, creating environments or having environments that have a lot higher levels of stress and mental health disturbance.
Now, is it fair to say that there's good stress and there's bad stress?
There is such thing.
Okay, okay, because I want to be clear that there is something of good stress and bad stress, and so they won't think it's just the negative atmosphere, if that's fair to say.
True, but I mean, then again, it's remember stress is individualized, and so just because I'm glad you asked that question, because I don't I don't want to make a blanket statement to say because you live in a certain area it means you're going to have mental health disturbance. That's not what I'm
Right.
saying at all.
Yeah.
What I'm saying is that in life, everyone has stressors that they have to navigate. And the theory behind mental health is that um, people who have undue amounts of stress just have a higher propensity or likelihood to potentially have difficulties managing their mental health. And so if you think about it in your own lives, I don't care how comfortable you are in your own existence. Imagine um, within your comfortability, if you will, there's things that happen to you that strip that comfort from you. There's going to be some stress that's associated with that. And so then the question becomes, how prepared or how equipped are you in order to manage those stressors, so that you can continue to function the way that you need to function in order to navigate your obstacles. And so that's what mental health really is all about.
Mhm. Very interesting. On that same note, uh, have you found that those stress factors impact a certain ethnic group more than another ethnic group? And if so, how is that? How is it impactful?
Now, that is a really complicated question. And I'll tell you the reason why. With within a given context, people may not even understand or even have the realization that stressors are what they are. And so what I mean by that is there are cultural implications to mental health. And what that means is that within a given culture, if these are cultural norms, then I don't even recognize it as something that may be considered to be abnormal,
Right.
if that makes any
Yeah.
sense. So in other words, um, if everyone around me is poor from an economic standpoint, and everyone I know is in the same economic um, condition,
Hmm.
then I may not have the stressor of not having economic resources because I don't recognize that it's an issue.
Interesting.
Does that make sense?
It
And
does.
so there are cultural implications that are associated with mental health. And so I don't want people to think it. So when you start seeing labels on communities or labels on people or ethnic groups in regards to propensity, there's a lot of additional questions that need to be asked. The other question that needs to be asked is who's doing the evaluating?
Very true. You're absolutely right
Because
about that.
right, because if the standard of mental health, if the standard of good mental health is defined by a select group of people in a narrow cultural group, then how can they um, effectively um, define people's mental health to everyone that's outside of that group? And
Right.
so that's why I think it's really, really important to connect with providers that not only have a good, I guess, educational background and understanding of potential mental health complications, but also are able to connect with you on a cultural level. And it doesn't necessarily mean they have to be the same color of you, but they have to be aware of your cultural norms so that they can really make a true diagnosis. Let me give you an example. If I have a client that comes into me and says, I've been having a really, really difficult time, but in the back of my mind, I can hear my grandmother telling me, it's going to be okay, baby, you're going to make it. I can see how one person may hear that report from a patient and say, well, they're hearing voices. Maybe they have schizophrenia. But another
Mhm.
person may hear that same conversation and say they are using their resilience in order to um, manage their stressors and overcome their obstacles because they're harnessing their relationship or their past relationship with their grandmother in trying to navigate their obstacles. And so that's why it's really, really important to link with a provider who understands culturally what your norms are and what
Mhm.
your experiences are so that you don't get misdiagnosed. And unfortunately, a lot of times that may fall on the patient. And so that's why I think what you're doing is so important, bringing awareness to this because we can educate folks on the things that they need to look for when they are quote unquote shopping for a mental health provider.
Well, that's very important. You mentioned about the doctors as well. And thanks for saying that. I think it's important to bring awareness about mental health. It's overdue. It needs to be on the table every moment. It really should. I think every month should be mental health, to be
Yeah.
honest with you. But it's funny you mentioned about the physicians because you're right. I think you have a cultural understanding. It kind of limits some of that bias as well.
Mm-hmm.
So that's very good brought that up. I want to talk about some of the stigmas with mental health. As a kid growing up, I would hear all kinds of things when someone's been diagnosed with mental health. I hear some things like they should shake it off or they're looking for attention. Why is there so much stigma with mental health? You can talk about that a little bit.
Mm-hmm. I think in our culture, it's people people are accepted if you have a physical condition and they are apathetic. But for whatever reason, if you have um, um, challenges with your mental health, then you're seen as weak. And I think that is um, something that's been culturally propagated for a really long time. I think we are in a bit of a golden age of mental health though, where folks are understanding the importance of mental health and are being a lot more open about
Mhm.
their mental health journey and the things that they struggle with. Um, so I want to tell your listeners and whoever is going to partake of this presentation that I don't care who you are, I don't care what ethnic background you come from, what economic background you come from. Every single person at some point in their life has asked themselves some very, very hard questions about what am I doing here? And am I making a difference? Do I matter? Every single person has asked themselves those questions. And so if people are out there still today wondering if they are different or if something's wrong with them because they're asking themselves those questions, the answer is no. Everyone has asked themselves those questions. And so just talking about how important these things are, I think sometimes can give a lift to some folks emotionally because the stigma that's still attached with mental health. I don't want to talk about it. I shouldn't talk about it. It means that something's wrong with me. And Hollywood doesn't do us any favors when it comes to mental
Yeah.
health either, because in Hollywood, everyone who has a mental health disorder is the literally the most extreme version of it. The Joker and the Batman movies and you know, the mastermind criminal who wants to take over the world. These are Hollywood propagated extreme examples that in the real world of mental health we hardly ever see or practitioners will never see. Um, People are shocked to find out that the vast majority of people who are have a mental health diagnosis or have some type of are receiving some type of mental health supports work with you, go to church with you, you know, you interact with them every day. They teach your kids, they care for you, they cook your food, they're driving your Uber, um, they're sitting next to you at work, and church and everywhere else. And so that's the real world of mental health. Is that, and I'm not saying everyone is out there that has a problem or everyone's on medicine. That's not what I'm saying. What I'm saying is when we look at folks who are managing their mental health conditions, The vast majority, the highest percentage of those people are doing the same thing that we're doing, and that's going to work and going to school every day and trying to figure life out. So there's nothing wrong with doing those things. Everyone is doing the same thing. 99% of the world is doing that. Going to work, going to school, trying to figure life out and be a better person and make a contribution in the world. And if we flip it on its head, the world would make us think, or, the media would make us think that the whole world is on fire. And in reality, if you kind of like really think about it and look around, pretty much everybody's doing the same thing every day. You go to work the same way every day. You come home the same way every day. And guess what? Those same people on the road are doing the exact same thing.
Yeah,
So
yeah,
really, things aren't as bad as they perceive, as it's perceived to be. Um, and so I think media does a really poor job of um, um, it really showing what folks are really going through on a day-to-day basis. Because I'm not saying there aren't dangers out there, but for the most part, the vast majority of people are just decent folks and they're trying to just figure out what they need to do in order to maintain themselves and maintain their families. And that's pretty much it.
yeah. Garvey, it's I'm glad you said this. How many people out there that we know or know of that are struggling with what they perceive maybe mental health, but are ashamed,
Mm-hmm.
afraid to talk to someone about it
Mm-hmm.
because of those stigmas. They may
Mm-hmm.
think someone may think they're crazy,
Mm-hmm.
or they again attention seekers,
Mm-hmm.
um, just looking for excuse.
Mm-hmm.
So that's a very good point. You're right. The Hollywood doesn't help. Those characters you mentioned doesn't help at all. I think you're absolutely correct when you said that. And I guess, is it fair to say you feel a certain way, or know that something maybe you're concerned with something is the best to seek attention or seek help from a physician
Yeah,
standpoint?
I would say this is what I would say. Anytime you're going to go see a mental health professional, whether it be a person like myself who, I specialize in medication management. So if you feel like you need medication, and we can talk about that, then you would come see me. But you don't necessarily have to have medication. You don't necessarily have to be, hospitalized. You don't have to.
Mhm.
You can talk with a therapist. You can talk with a counselor. Um, and when it really, really gets down to it, the crux of, at least in my opinion, of good mental health, or in regards to the therapy aspect of it, is you're able to just get new perspective.
Mhm.
What happens a lot of times is, whatever information was given to us by the people and experiences that we've had in our lifetime, that's the only narrative that we know. And
Yeah.
so we're trying our best to figure out the world based on this limited narrative that we have about how the world works. Good therapy will challenge that. Good therapy will say, well, why does it have to be this way for you? And what other possibilities are there for you in regards to either how you see the world or how you react to the world?
Mhm.
And those conversations are important, because so therapy really should be challenging you to open up your perspective and consider other options and other opportunities and other avenues and other mechanisms in order to accomplish the things in your life that you want to accomplish. And sometimes it's just really difficult to do when you just haven't had the exposure, or understanding of how to do those things. So that's really the value of therapy. So instead of looking at it as something that is either taboo or negative, or um, that it's an indictment on you as a person or an individual, look at it as something explorative. It's
Mm.
interesting to me. We will seek advice from all types of folks
Yeah.
that
Right.
may or may not have the ability to effectively give us information that's going to be relevant to what we're trying to do or not. You know what I mean? Like, but that's just human nature. Like, we go to our circle because it's a comfort zone for us. And so,
Mhm.
even though no one in my circle has ever done this before, that's the first group of people I'm going to consult. But they
Right.
don't have a reference point. They can't tell us, what to do. You know what I mean? Like, if I'm trying to buy if I'm trying to buy something, if I'm trying to buy a house and no one that in my group that I talk to has never bought a house before, they don't have a reference point. I need to go talk to some people who have bought a house before so they can
Right.
tell me what to look out for, what the pitfalls are. And so a lot of times that's what a good therapist can do. They can talk to you when you're telling them about what you're experiencing. They can say, aha, well, what I'm hearing is this, and this. Have you considered maybe you would want to approach it this way, or maybe you would want to angle it this way? And they could just give you better perspective on how to manage the things that you're experiencing.
Yeah. I like how you say new perspective. That's you're right, new perspective, and someone who knows, who is specialized in that area, to really talk with. Because a lot of time, as you said, people run to someone they have who they've comforted in talking with, that circle. So new perspective is very very valuable that you brought that up.
Mm-hmm.
Um, Actress Regina King recently sat down and talked to Robin Roberts of Good Morning America. And in that interview, she talked a little about her son Ian, who passed away from suicide
Mm-hmm.
back in 2022.
Mm-hmm.
Continuous prayers to Regina King and her family from the
Mm-hmm.
Let's Talk family here. But I want to read a quote that she said during that interview, if I may. Uh, Regina King says, when it comes to depression, that people expect it to look a certain way and they expect it to look heavy. That leads me to this question. What are the warning signs of mental health issues or disorders? You can elaborate on that a little bit, Garvey.
So I think the first thing you would probably look for is what we considered in the business to say a change in baseline. And basically what that means is this: we are used to um, um, we are used to people acting in a certain way and responding in a certain way to their current life situations. And so, for example, normally Junior is um, a little on the happier side, and he likes to play with his friends, and he likes to play video games, and he'll get up on Sundays and go to church with us, and those types of things. And as a parent, like if we're going to use this kind of scenario, um, if we start seeing changes in those behaviors, then it becomes responsible. Um, it becomes our responsibility to kind of maybe do a little bit more investigation to see what's going on. So why are we losing interest in the things that we used to have interest in, and why are the grades not as good as they were, um, you know, last quarter? And
Mm-hmm.
um, why is the interest in the video games not as prevalent as it was, a month ago, and those types of things. So those would probably be some of the first kind of telltale signs when folks are maybe experiencing, specifically when we're talking about depression. But you're absolutely right. So many times, and we've seen this over and over again, especially with folks in Hollywood, that you have situations where at least we would think that people could have everything that they wanted, and they have access to fame and fortune and resources that we may not have. And but that doesn't necessarily mean that um, those folks don't have issues with their mood or issues with depression. And so um, it doesn't. So I think it's a good reminder to say it doesn't really matter what a person's status is um, in our culture. What's more important is, um, how are they functioning, and um, what is their ability to cope with whatever stressors they perceive are prevalent for them. Because we've seen too many times, we've seen too many times in our society where folks who allegedly had everything to live for, ended up being the most depressed. And so um, it's definitely something to watch out for. So there, I don't want to, I don't want to label things as telltale signs, because there's not necessarily telltale signs of if someone is 100% depressed and in danger of hurting themselves. But if if we're noticing that people are not their usual self, then we need to wrap some additional supports around them to make sure that they are receiving the support that they need in order to be to function as much as they can.
I want to ask you, Garvey, are the signs different for children versus adolescents versus adults when it comes to mental health?
Mm-hmm. Yeah, that's actually a really, really good question. If you're talking about really young children, really the only thing you have to go by is behavior. Um, Very young children that are, 5, 6, 7, 8 years old don't have the social capacity to eloquently express what
Yeah.
they're experiencing, right? And so what you may see is agitation, what you may
Mm-hmm.
see is um, odd and abnormal behaviors. What you may see is, um, um, biz- you know, bizarre behaviors or behaviors that don't make a lot of sense to you. Like, why are you doing those things? So in younger children, it really shows up behaviorally a lot more. When you get to adolescence, um, you'll see behaviors in the behaviors are more for whatever reason with adolescence, you get kind of the extreme that you kind of see is, and this is my personal experience, is either acting out acting out behaviors towards others. In other words, I am getting into fights and you know maybe like extremes like property damage and
Mm-hmm. Yeah.
things like that, or it'll be turned inward where I'm using drugs or being promiscuous or um I may be having some superficial self-harm behaviors and things like that. And so for teens, you may see those
Mm-hmm.
types of behaviors as indicators that there may be something wrong. So what I'm saying is kids who have these behaviors a lot of times just get labeled as bad,
Yeah. Yeah.
which is unfortunate.
Yeah.
But you have to really think about it. Um, Kids don't have the life experience or the social ability um, to illustrate in words what they're really experiencing. And so what it is, it manifests itself in behavior. And so if you have a kid who is acting out towards the community, in other words, um, he's getting into fights and getting into trouble at school and things like that. That's really what that kid is really saying is I'm feeling some type of way on the
Mm-hmm.
inside,
Yeah.
and no one has taken the time to really try to work with this kid to understand what's going on and what those stressors are. You know
Yeah.
what I mean? So there's opportunities for us there. Um, as you move up into adulthood, those signs and symptoms become less and less. And as a matter of fact, the older adult is, the less signs you would probably get. Um,
Interesting.
yeah, and um, so this will go out to all of the people in our age group and maybe a little bit younger that are in those middle years who are still focusing on the kids and our careers, but at the same time, we have aging parents.
Yeah.
It's really important to keep connected with them and um, in touch with them and including them in the process because sometimes they get kind of lost in the shuffle there.
Mm-hmm.
But if they have interest, that social interest in things that they're doing, that's great. We want to encourage that.
Mm-hmm.
Um, But if they don't have a lot of social connection, then we want to try to find a way to kind of keep them locked in and keep them included in the process. Because a lot of times, like I say, the older you get, the less signs you'll see. And so you may have an older member of the family who is experiencing maybe some depression or loneliness. And you're not really recognizing it because you're not paying attention to it, and they're not going to tell you anything about it.
Yeah, yeah. I want to back up just a little bit, Garvey. When it comes to the adolescents, and particularly, coming up, they taught you about sex education. Are
Mhm.
they teaching the students today in most of these high schools and middle schools about mental health so they can have some kind of awareness on their end? Are you aware of any of that with the school?
There, there are the school systems have, I think, have done a little bit of a better job of understanding that kids have significant perceived stressors. Remember, this is perceptual, right?
Mhm.
And because as parents, we're kind of like, why are you worried about that? You know what I mean? Like, that's just silly. But to a 16-year-old kid or a 15-year-old kid, a lot of these, not a lot, some of these experiences they have feel like life or death to them.
Yeah.
And again, it's because they don't have enough life experience to understand this too shall pass. And so, a 14-year-old kid and they're having their first breakup feels emotionally like the worst thing that has ever happened to them because it is the worst thing that has ever happened to them.
Right. Yeah.
They haven't had a chance to be 35 and 40 yet to understand there'll be plenty of other relationships that
Yeah.
you'll have.
Right.
And so as adults, it's important for us to remember that as kids, this might be this is their first experience with loss and stress. And instead of us being punitive, we need to be supportive.
Yeah.
Um, and but in the hustle and bustle of things, a lot of times as parents, we don't have time. Like we don't have time to deal with that. You know what I mean? Because like, listen,
Hmm.
your job to go to school, I'm paying these bills.
Right.
You know what I mean? Like we don't have time for all of this stuff. You need to just act right and do what I tell
Hmm.
you to do.
Almost a keep it moving type thing.
Exactly. Yeah.
Yeah.
But it's really, really important. So if parents are out there wondering like how they can, how they can get their kids to kind of buy in more,
Hmm.
you know, there has to be buy-in from both ends. You know what I mean? And so you have to
Hmm.
be kind of be tapped into your kid to say like, hey, listen, what's going on with you? What have you been experiencing? What have you been feeling? And how can I support you? Like as your parent, like how can I support you? What can I do for you? As opposed to kind of like shooing it away. So I'm not sure if I really um answered that question adequately for you or not.
Yeah, I think you did. I was just trying to also verify if the schools also have some type of uh curriculum or something to do with the especially the adolescents again when they're coming into the schools and kind of talking to them about mental health in case
Mm-hmm.
they may be experiencing something and then that topic
Mm-hmm.
has come up in the school. Say, hey, talk to your parents or whoever they confide in or feel safe talking to about. I just was wondering, do they have, because as I said, coming up we had sex education in
Mm-hmm.
school, and
Mm-hmm.
then and this is a different day and time, and
It
that's
is.
mental health is something that's very serious topic. And I think a lot of times I've known people who have children who have mental health issues, and I don't recall even the parents telling me that they have taught that in school or brought that
Mm-hmm.
issue up in school or not. That's why
Mm-hmm.
I want to come find you if that's
Mm-hmm.
something that you're aware of that they are doing this day and time,
I
talking to kids about mental health.
I am I don't I'm not privy to like specific school systems and programming or curriculum that's offered. I will say that generally speaking, I think schools have done a little bit better in recognizing that mental health, especially with adolescents, is an important issue.
Hmm.
I'm not I don't think I'm not convinced that there is adequate infrastructure that has
Ah.
been put in place to address all the needs that potentially need to be addressed in a given
Hmm.
school system or a given school. Does that make sense? Because
Yes, it does.
um and I mean there's counselors in every school, right? There's counselors in every school, and these are educated folks who are that understand the needs of kids and um you know what kids need to, what kind of supports they need, but then they're limited. And
Hmm.
so if it's a parent's expectation that a school counselor or that the school system is going to provide adequate mental health support for their kid, I would make the argument that it's probably not going to be sufficient. Like it's just
Mm.
not, because there's too much volume. And
Yeah.
so adolescence, and when I say adolescence, I'm basically saying like middle school to high school.
Hmm.
So sixth grade probably up to 17 is probably the most critical time for kids and their mental health development in regards to how they learn how to navigate obstacles in the world. And I will make a strong argument to say, if you are a parent and you have concerns about um, your kid in that age group, You should not be solely relying on the school system to give them the supports that they need in order to navigate those obstacles. Now, having a counselor or having, allowing your kid to go to therapy can give them just the outlet that that kid may need to just
Mhm.
purge whatever stressors they have.
Right.
So if the parent is saying, well, listen, and I'm not trying to be funny because parents are out here trying to figure out how to get things done.
Yeah.
So if the parent is saying, listen, I don't have all of the answers, or my focus is too narrow because this is my kid and this is
Mhm.
what I feel like they need to do, but you're recognizing that maybe this kid still needs some additional emotional supports,
Yeah.
a counselor might be a good place to start. And then with things being done virtually these days and things like that, you don't even have to you don't have to take your kid anywhere. Like the kid could be on his phone talking with
Mm-hmm.
their counselor or their
Yeah.
therapist on the phone. And so there's resources that are available that I think a lot of times parents should maybe think about tapping into. Um, and then the other thing about it is, as a parent, or anyone that's seeking mental health supports, you should shop around for someone that you really kind of feel has the same philosophical view that you do,
Mm-hmm. Right.
and the same cultural view that you do, because then there can be a connectivity and an understanding of what your potential life stressors are so that they can help you navigate those obstacles. So I think the schools are doing better.
Okay.
Um, but I don't think that anyone should be have the expectation that the schools are have the capacity to provide the level of support that many students may need in order to kind of navigate their obstacles.
What are some of the assessments that can diagnose and or treatment those who may possibly have a mental health illness or disorders?
Mm-hmm,
And
mm-hmm,
even some of the prevention, you can talk a little about that in
mm-hmm.
particular assessments.
So assessments, there, I mean, and um, there's a bunch of types of screenings and assessments that a typical provider would maybe use in order to ascertain if someone has a mental health diagnosis or not. And so, but honestly, the crux of most mental health diagnosis is going to be on evaluative assessment, and that basically is the interview between the patient and the practitioner. And what we'll talk about is, what are the things that are causing you the most distress? How are those things showing up in your life? And are those things keeping you from functioning the way that you feel like you need to function?
Mm-hmm.
And it's
Okay.
really, so if you think of it that way, it's really no different than when you go to your medical doctor. Because when you go to your medical doctor, you're like, my arm hurts. And they're like, okay, how long has this been going on? Tell me about the pain. What is the pain keeping you from doing? Have you been doing anything else that has been contributing to the pain or made the pain not as bad? So they're asking you the same types of questions, and then they're going to make a diagnosis, and then they're going to make a recommendation on treatment based on what you tell them. So mental health is no different from that.
Mm.
And so the only things that may be some difference is making a decision on the treatment side, what is going to probably be the best way for you to navigate your process. Now, it's my personal belief that patients are the ones that are supposed to make those decisions. As a practitioner, it's not my job to tell you what you should do with your health. It
Right.
is my job to inform you of what the options are. And then
Mm-hmm.
we can talk about what way you want to go with your health. So
Team effort. Is that the
it
team
should
effort
be a
piece of
team
it?
effort. It has to be
Yeah.
patient led, because ultimately you're the patient, and I want you to be as compliant as you need to be with your
Mm-hmm.
version of what you want for your health. And so there
Mm-hmm.
are some times where people come to me and they think that they want medication, but by the time we finish talking, they may come to the realization that, you know what, I don't think medication is right for me at this particular time. Let me go and try some other things first.
Yeah.
And so as a practitioner, that's my responsibility. And so just because you come to me doesn't necessarily mean you need to be on medication, even though that's what I specialize in. Just because you start medication doesn't necessarily mean that you have to be on that medication
Right.
indefinitely. depending on what your diagnoses are. There are some diagnoses that if you start medication, you probably will need to be on medication indefinitely. But there are other diagnoses that just because you start medication doesn't necessarily mean that you have to be on medication indefinitely. And so if you have a client, um, it is, if we have situations where those are possibilities, then we have to discuss that as a part of your treatment plan. And we'll discuss that at the very beginning. So listen, this is not necessarily a medication that you're going to have to be on for the rest of your life, but you may need it as support
Mm-hmm.
for what you're going through at these moments and help you get on the other side. And because you need to build some resilience in the meantime.
Mm-hmm.
Um, yeah.
I'm glad you brought the point up that patients do have an input in the say in their health. I'm glad you said, because all too often patients go to see a doctor, and the doctor is telling them things and they don't say anything at all because they figure they are the doctors, they know what's best. But I'm glad
Mm-hmm.
you said patients do have input, because
Mm-hmm.
it is about them. They have
Mm-hmm.
a right to ask the questions they need to ask. They have a right to talk about the medications they may be prescribed or have to take, whatever the case may be.
That's
But they
right.
do have input on their health.
They
Because
should.
as I said, all too often they think they don't have any input.
Right. No provider should be, and I'm going to speak for myself. No provider, in my opinion, should be shooing people out of their office when they're asking questions about their health. That that's this is my body, this is my brain,
Mm-hmm.
and I have questions.
Yeah, right,
so
exactly.
so if I am going to be your provider, I need to create space that allows you to ask whatever you need to ask and get the information that you need to have in order to make the best decision that you want to make in regards to your care. I've had clients that tell me, well, whatever you say, whatever you say, I'll go with because you're the expert. My retort to that is, okay, but you still have to be a part of this process. And
Mm-hmm.
so again, here's option A, here's option B, here's option C. What do you feel? What do you feel is going to be the best course of action for you in regards to your treatment? Um, and so that's just my approach. So if that's an approach that's agreeable to people, then when you're shopping for a therapist or for a mental health person or even a medical doctor, then you look for people who share that philosophy. So if you are going to a provider's office and they only want to spend 5 minutes with you and kick you out of the office, maybe that's not your provider.
Right.
You know what I mean? And so you you have the right as a patient to seek someone who values your time as much as you value that professional's time. And it has to be a collaborative process.
Yeah, absolutely, absolutely. And I think sometimes part of that is the fear, the unknown when they're coming into an office, wondering, not all patients, but what's going to be the outcome of that. And they feel they're at the doctor's office. This is someone that is in that field, that area, and I need to really just go ahead and listen to what
Mm-hmm.
they're telling me.
Mm-hmm.
But you're right. It's they should have an input in their care. And
Mm-hmm.
as you said, if they can't have an input and they don't feel comfortable, they really should seek for another doctor or
Yeah.
physician in that
Mm-hmm.
area they're concerned with, that specialty in a lot of cases. Are there any prevention measures when it comes to mental health? And if so, can you kind of talk about that a little bit?
Um, so I guess the only thing I would kind of say as a practitioner is um, if you try not to place yourself in, try not to add on additional stressors that are unnecessary.
Mm,
So, um, again, physical health and mental health are tied together. So if you are in better physical health, you have the opportunity to be in better mental health and vice versa. Um, if you are participating in activities that alter the way that you think and alter the way that you feel, then you're not experiencing reality um, as it presents itself. And
right,
so you may be robbing yourself of an opportunity to build resilience because you're in an altered mental state. And so people can take that and do what they want to do with that. Um, but um, but I understand sometimes coping is hard. And so if coping is hard and coping is difficult and you're using self-therapy and adjunct therapy that you've created on your own in order to cope with that, those things are fine to a certain extent. But at some point, you have to give yourself permission to try to figure out a different path that's going to be potentially more productive for you. So in other words, if you're using substances, for example, in order to um, alleviate your stressors, that can only work for so long,
Yeah.
right? There's going to have to be a point where there's a there's new skills that are learned so that you won't have to be dependent on substances in order to meet the challenges of your day. Does that
Yeah.
make sense? And
It
so
does.
um, I would just really encourage people to um, consider exploring other options, and therapy and medication are other options. And um, now, and I'm just saying that as an opportunity for people to explore, because um, I think there is a prevalence in, at least in the African American community, to shy away from mental health. I believe that narrative is changing. Um, but if the things that you are doing are not working for you, then it's your
Hmm.
responsibility to try new things in
Yeah.
order to see if something else can work for you.
Right.
Um,
Right.
so, but stress reduction and not purposefully putting yourself in stressful situations is probably the best remedy, if anything. Um, but being physically active, eating right, um, surrounding yourself with circles of people who are positive. You know
Hmm.
what I mean? It sounds really like simplistic, but these things are like really really important and ideal. I mean, you're what you feed yourself socially, spiritually, physically, and mentally is going to affect you. And so if you're feeding yourself junk food and junk people and tabloid mess all the time, then what outcomes do you really expect to have? And so
Right.
changing those dynamics will help change your trajectory and help change your outcomes for yourself if you're able to make those changes. So changing physically what you consume, socially and spiritually what you consume, and changing those things into positive things will have a big impact.
And that goes back to the being as a whole, you being a whole person. And very good analogy, when you take in is the outcome makes a difference,
Mm-hmm.
basically, is what you're saying, is that
Absolutely.
I gathered. So very good point. So that's very important for people to know. You treat yourself as a whole, prevent those stressors that keeps you going, to prevent to kind of like guard you from maybe getting mental health issues. I think that's a very good
Mm-hmm.
point. I appreciate that.
Sure.
Now, something I want to ask you, Garvey, for those people who may not have any insurance,
Mm-hmm.
what we call uninsured people, what advice would you give them that if they feel that something is wrong, but know they don't have any insurance, but they know that they need the help? What
Mm-hmm.
advice can you give those people?
Well, there is the national suicide number that just came up. I believe 988
Hmm.
is the
The
um,
crisis line.
crisis line for
It
that.
is.
And so there's resources there. So, but again, that's for crisis. So if you're in a crisis and you don't know what to do, you can dial that. If we're talking about folks that say, you know what, I really feel like I need to talk with somebody, but I don't have insurance. I'm not insured. I would probably start at your local community service board. And what I mean by that is, if you live in the city of Richmond, you would call Richmond Behavioral Health Authority.
Hmm.
If you live in Henrico County, then you would call Henrico County Mental Health. If you live in Chesterfield, you would call Chesterfield County Mental Health. If you live in Petersburg, Emporia, Hopewell, those areas, you would call D19 or District 19, which is Petersburg Mental Health. And there are resources and programs and information that is available. There is a possibility that you may qualify for coverage that you did not know about. And so those that would be probably the places I would start in regards to trying to access care if I did not have any insurance.
Those who are out of the state of Virginia, is that you said contact the community board within their community
Yeah,
or the
that that
social
that should
services
pretty
or
much, yeah, that should pretty much be universal.
Mhm.
That should pretty much be universal wherever you go in regards to um, where you live. Now, every state is a little bit different, and so
Right.
there may be some states that don't have a healthy mental health infrastructure, and there may be some barriers there, and so, but there may be opportunities for you to get online and find um, practitioners that are willing to work with you on a sliding scale fee and things like that. I've heard of, therapists having very, very, some therapists or some practices that do sliding scale fees, and they're able to help folks who don't have any insurance, and the cost to see someone is still not is still economically viable for them to do so.
Appreciate that, Garvey. I want to talk about a support system or support groups rather for those who do have mental health issues or have been diagnosed with mental health disorder, and not only for those patients, but also a lot of times they have caregivers. What are some of the support systems that are out there or support groups that you can kind of say, hey, this is a good thing to go into, or are there any support groups for people with mental health
There
issues
are
and need caregivers?
yeah, there are support groups, and I don't have a bead on like specific
Mm-hmm.
um, groups or organizations that are offering support groups. So I would have to do the same thing everybody else would do, which would be go online and Google it.
Right.
But yes, but the point that you make is 100% accurate. If you now sometimes people are adverse to groups because they're like, well, I don't want to be in a setting with a bunch of other people because I don't want
Mm-hmm.
everybody knowing my business and those types of things.
Right.
Um, but if you let me tell you that there's advantages to groups. Number one, the probably the biggest advantage to group is perspective. So I want your listeners to hear me out on this. There's actually two: perspective and cost. So let's do that. If you are most of the time, if you're in a group, and if it's a group that costs, like this is a therapy group, like a depression therapy group or an anxiety therapy group work usually from a cost standpoint is a lot more affordable than individual sessions. So that's
Mm-hmm.
number one. Number two, so if we're talking about those folks who are uninsured, group might be a place to go because you can get the emotional support that you need. But the other thing about a group that's dynamic and unique is that you have the perspective support there as well. Because if there's 10 people in this group, that means if I'm there, there's nine other people that have similar issues that they're struggling with, but there's
Right.
nine different perspectives on how they manage those stressors. And so now that gives me an opportunity, instead of just talking to one therapist, I have the opportunity to gather information from nine other people on how they've overcome their potential obstacles that can give me perspective on how I can overcome my obstacle. So group work a lot of times can be a really effective way on um, not only economically being able to get the emotional support I need, but just logistically and from a support standpoint, there's a network of folks that can
Yeah.
kind of help you navigate that. And anytime you're doing group work, it's always confidential anyway. So whatever happens in the group stays in the group. So if people are having fears about their anonymity or privacy being part of the issue, that is part of group work and group dynamics, is that everyone is supposed to sign documents to say we'll keep this information confidential. So I would really encourage people to look at that if they feel like that's a viable option for them.
Yeah, they got that word in perspective, but also too, Garvey, they don't feel alone anymore.
That
They feel that someone else
absolutely,
have something in common with someone else. That just feel that
absolutely,
they're all alone. No one else
absolutely,
but I. Yeah,
absolutely.
very good
Hmm.
point. So I thank you for that. I want to ask you too, Garvey. What are some of the specialists that actually can diagnose someone or actually see someone who has a mental health illness or anal disorder?
Very good question. So a lot of times people will start with their PCP, which is completely fine. So your PCP um, has the capacity, both legally and from a clinical standpoint, to probably assist you in the starting of the management of whatever mental health concerns that you have. Um, I would probably make an argument that if we're talking about your medical PCP, they're probably going to be limited to pretty much anxiety and depression. So if you are experiencing onset or exacerbations of your anxiety symptoms or depression symptoms, your PCP from an initial standpoint could probably begin the process of helping you manage those emotions if medication is the route that you want to take. Now, obviously, if therapy is the route you want to take, then your PCP can't do that.
Mm-hmm.
Um, Once we get past your PCP, then if you get into the community mental health prescribers, there's a bunch of different folks that you can work with. You can work with a psychologist, which is a person who does therapy and probably does some type of testing. Like, so if you need specialized testing for autism or for personality disorders or for mental health disturbance, they may be able to provide that for you. So that would be a psychologist. There is a licensed professional counselor who is usually a master's prepared clinician. Along the same line would be a LCSW or a licensed clinical social worker who also is a master's prepared professional and has been prepared trained to do clinical therapy with folks. And then you have your prescribers, your what I would call advanced prescribers in the community, which would be your psychiatrist and your psychiatric mental health nurse practitioners. And so the psychiatrists and the mental health nurse practitioners will work usually in tandem with your therapist.
Mm-hmm.
And they would only manage the medications and make sure that the medications were agreeing with you in a way that managed your symptoms and weren't causing significant side effects. And then your therapist would work with you on the emotional tools and building your resilience and your capacity tools. Now, patients have the right and to do and go in whatever direction they want. I have patients that only see me for medication management, and they don't see a therapist at all.
Now,
Um,
what is medication management? What
what
is
that
that?
basically means is you're going to see either a psychiatric mental health nurse practitioner or you're going to see a psychiatrist, and they have prescribed you a medication specifically to help you manage your mood and emotions or mental health condition. So they've given you a medication either for anxiety, depression, psychosis, bipolar disorder, something along those lines, in order to help you manage those conditions and symptoms. And because they prescribe you that medication, they want to keep in touch with you to make sure that the medication is still doing what it's supposed to do for you and that you're not having any complications because of it. So that's the relationship between when I say a mental health prescriber, that's the relationship that I'm talking about versus a mental health clinician or a therapist that will either be the psychologist, the licensed professional counselor, or the licensed clinical social worker who will do therapy with you on an individual basis or a group basis.
Well, I want to ask you a question. Is there a difference between a psychiatrist and a
Yes.
psychologist? And what is that?
So again, the psychologist is the clinical professional who will, whose primary function is either psychological testing and or therapy. The psychiatrist is going to be the person who would be prescribing medications and managing your medications.
Ah,
So the clinicians do not have licenses to prescribe medications. The only people who have licenses to prescribe medications are going to be the psychiatrist and your psychiatric mental health nurse practitioner, and of course your PCP.
awesome, awesome. Wow, that's quite a bit, Garvey.
Mm-hmm.
Is there anything else you want to kind of any other information you want to kind of give the audience that they can take along with them? Any information that you feel that all information has been valuable, number one, but anything you can kind of add to this to kind of
Mm-hmm.
take with them and kind of get them on the right track?
I would just really encourage people if they going to see someone to talk about your issues and the things that are important to you, there's nothing wrong with that.
Mhm.
And even if things are going well, it doesn't hurt to go and get additional perspective about how you potentially handle things and um, are there any strategies that you can use in order to be more effective in how you are managing your life stressors and managing your responsibilities. And um, but if you are experiencing some significant stressors and you are feeling um, overwhelmed, you're feeling lost, you're feeling uncertain, you're not quite sure what to do or how to do it, I would really encourage people to maybe go and talk to somebody. The thing that is good about mental health that's different than the medical world, when you want to go see a new doctor, you have to schedule an appointment and go see the new doctor, right? Let's say something happened with your old doctor and you want to go see another doctor. And maybe there's 3 or 4 doctors you're considering, you just don't know which one you want to go to. Well, in order to go see that doctor, you have to schedule an appointment and go see that doctor. What's nice about mental health is there is a good amount of mental health practitioners out there that will have an initial consultation with you for free.
Oh,
So
wow.
they'll have a 5-minute or 10-minute conversation with you, usually by phone, that they would be willing to talk with you for free. And that allows you as the patient to have basically to interview a
Yeah,
practitioner to
right.
see what they're all about, what their philosophies are, and if you really feel like they can help you or not. So it helps you give a vibe check before you actually go and
And
pay your
see you.
time and money.
Yeah, right.
So,
Absolutely.
so if you have a practitioner that is accepting new patients, and I am, and we are, and I'll give you my contact information in a minute, then we also give consultation. We give free consultations as a part of our practice. And so that really allows the patient to understand or get an idea, at least if they feel like we're a good fit for them. And if
Right.
they don't, then we'll give a referral. We'll refer you we'll refer you to other people. In regards to resources, if people are looking for a therapist in their area, there's a couple of resources they can use. They can go to Psychology Today online, psychologytoday.com, and there's a full filtering resource that you can search for ethnicity, zip code, state, specialty, condition, religion if you wanted to. So there's a lot of different ways you can filter out the therapist that you want. A gender if you want it. Headway is another one. Is another platform that you can use in order to search for a therapist. So there's a couple of different online um, platforms that you can use in order to search for a provider in your area or provider of your choice. So I would encourage people to do that. Um, so the internet is your friend and Google is your friend. So if folks are out there and they're wondering if this is something I should try, then I would definitely advocate that they do it.
Awesome. Great information, Garvey. I actually want you to come back, Garvey, at some point in time so we can actually get more of the specific mental health illnesses and disorders, a little bit
Oh yeah,
about
we can
that.
do
Yeah,
that.
come back.
Absolutely.
Now, how can the audience reach you, Garvey?
If you want to reach us in our practice, we are at talkworkheal.com. That's TALKWORKHEAL.com, talkworkheal.com. And all of our contact information is there. We'd love to be able to connect with folks and talk with folks. And so we look forward to helping people out in the community.
Garvey, I really appreciate you kind of taking the time to come on to Let's Talk. We
No, my
appreciate the
pleasure.
audience. Again, if you have any questions to reach Let's Talk, please contact Let's Talk. Go to the website, letstalk.org, or send an email to ingridlockley.letstalk.org. Good to see you guys again. Come back again. Garvey, thanks again.
You're welcome.
Appreciate that. Bye-bye.
Right.